Hi, I'm Linda Lamb. I'm a professor of ophthalmology at the USC Keck School of Medicine in Los Angeles, California. I'd like to thank the organizers for the opportunity to present this technology at the OIS Digital Innovation Showcase. Today, I will be discussing Ocutrx's technologies, specifically how Ocutrx uses augmented reality to help our patients with macular degeneration and our surgeons in surgery. I got involved in this space because I was really concerned about how our patients with macular degeneration are able to cope with their vision loss. And every week I had patients who came to me who discussed suicide. And with this technology, the patients who are using the headset have found new ways for vision and be able to read and see faces that they never saw before. So I'm really proud to be part of this great innovation and to be part of OIS this year. I will be discussing the Oculens AR headset or augmented reality headset for macular degeneration, as well as the OR lens and OR bot system for surgical visualization. I am a consultant to Ocutrx. So the first technology that I will discuss is the Oculens AR headset or augmented reality headset for age-related macular degeneration. As you know, the macular degeneration is the most common cause of blindness in older Americans. Macular degeneration creates a blind spot or scotoma in the patient's central vision. And currently, there are no products on the market to correct this AMD scotoma. As you can see on the right, the patient has lost their central vision, and it doesn't have to be uniform in area for this headset to correct for it. Ocutrx has patented technology, Oculens, to help these patients by using eye tracking, a visual field test, and pixel manipulation, as well as a technology for dynamic opacity, which senses the light environment of the patient. How does the Oculens work? Well, the first step, it takes a visual field test and uses in-home monitoring to send data to the user's doctor. The Oculens AR headset measures the shape and sizes of the scotoma and saves it as a scotoma marker, and the eye tracking follows the user's eye gaze. The image and text are moved around the scotoma. Without the Oculens, a patient sees the word and the lines of words and has areas of the words missing, and the letters are missing in this rendition. However, using the Oculens, you can see as the patient reads, the device displaces the area underneath the scotoma that's missing onto areas of the patient's actual vision that are still healthy in the retina in less than 10 milliseconds. So without the Oculens, as you can see on the left, the letters are obscured by the scotoma, and with the Oculens, the images are moved outside the area of the scotoma, making the letters that were previously missing visible. Well, does this work? Well, in our previous rendition of the headset, which did not use eye tracking, patients were on average about 20/200 or legally blind, and wearing the Oculens, they improved about 4 to 5 lines of vision and was able to see around 20/63. They also were not able to discern faces and could recognize faces after wearing the Oculens headset. If you want to watch a video of a patient actually using the previous headset, you can scan the QR code and you'll be able to see this video. Right now, I'll pivot and talk about how the surgical system can help our surgeons in the OR using augmented reality. What are the limitations of the current surgery systems that we use? Well, the ergonomics are very limiting because it causes back, neck, and arm strain during operations. With the current operating systems, there's also space constraints using the standard operating microscope and digital camera. It uses important real estate in the operating room that are in the center, and these areas are quite large that the current systems take up. In addition, the resolution of the current surgery systems are poor and are limited at 1080p and do not have true 4K resolution. Currently, the 3D glasses have significant limitations and block 50% of light and obscure the surgeon's vision. The OR bot is a visualization theater that Ocutrx has developed, which use 3 different visualization methods for the surgeon. This is quite innovative because some surgeons might still want to use a microscope device in front of their eyes. And you could still use that setup using the mini lens digital microscope. Another option is using the stereo lens, which is a monitor that you can see in the center here. This monitor allows both the surgeons and the technicians and students in the room to see in 3D without using 3D glasses. And the last is right here, which is the Oculens XR headset, which allows surgical video feed in 3D with 6 degrees of freedom. This solution separates the camera from the standard operating microscope and reduces space constraints. There's cobotic arms that are voice and touch activated for improved ergonomics, and this system is wireless. This is the augmented reality headset that allows for streaming surgery video feed and has patented eye tracking technology. Depending on where the surgeon looks, there are overlying med tile displays that encode important vital information overlying the area of surgeon's viewing. You can see here on the bottom right, the med tiles that can have very important parameters for the surgeon that are the patient data that directly overlay on top of the operative field.
Introducing the ORBot Surgery Visualization Theater, offering 3 unique viewing options based on a surgeon's preference. Let's explore, shall we? Replacing the legacy microscope, our 3D microscope captures surgery images with dual 6K cinematic sensors with 12 times magnification. The mini-lens 3D digital ocular viewport provides stereoscopic 4K clarity so you never miss a detail and is mounted on a cobotic arm ergonomically moving as the surgeon adjusts during long surgery. Next is our StereoLens 8K 3D monitor, enabling multiple users to see pristine 3D video from the digital surgery microscope without wearing 3D glasses. Next, our revolutionary ORLens XR headset displays 3D holographic images and drastically improves ergonomics by giving surgeons freedom of motion and positioning. ORLens headsets are available for surgeons, techs, and students, which will help bring learning alive. Surgery plans and pre-op imaging can be uploaded to the ORLens and will connect to other ORLens headsets for state-of-the-art telemedicine and telesurgery assistance. The ORLens headset has a 4-hour battery life and contains a hot swap battery, which allows a battery to be changed without interrupting the digital surgery feed. The ORBot follows virtual track markers on the floor, making it retreat after surgery or change positions to the other side of the gurney automatically, and making it faster to reset the OR after each patient, meaning more actual surgery time. Our articulating arms are operated using cobotic technology and position instruments using voice or touch activation. The ORBot will soon benefit surgeons of all disciplines with much-needed ergonomic improvements, state-of-the-art 3D visualization, and access to remote telemedicine information, and, most importantly, will reshape the very way healthcare is delivered.
That was an overview of the surgical system, and the 3D monitor comparisons between Ocutrx's system versus Zeiss and Alcon are displayed right here. And you can see, most importantly, the latency is quite different between this system using augmented reality at less than 20 milliseconds compared to the Zeiss and Alcon systems, which are over 80 milliseconds. And the resolution of the images is 13.6 megapixels versus 4.2 on the Zeiss and 2.1 on the Alcon system. In addition, the surgeon and the assistants do not need to wear 3D glasses to be able to see in 3 dimensions. So Ocutrx has significant competitive advantages over the current space in augmented reality, given that it has the highest resolution in the augmented reality space. It uses wireless technology, and it is the lightest weight and the widest field of view in the augmented reality space. It also allows for eye tracking, and there's something called dynamic opacity, which accounts for the lighting in the room, and it changes the headset shading depending on the ambient light of the patient or the surgeon. I thank you for your attention and the opportunity to present this exciting and innovative technology during the OIS Digital Innovation Showcase. Thank you for your time.